Hi, everyone. Thank you so much for joining us today. We are Igniting Change, United Way Unfiltered podcast. I'm your host, Ginny Hoyle, and with us today is Amy Wuest. She is our Director of Health at the United Way of Southeastern Idaho. Thank you for joining us, Amy.
I'm so happy to be here. Thank you for having me.
I am so excited to chat with you today. We're going to be talking about all things health. But first, I just want to say, we actually are besties IRL.
I know, it's amazing. Because of our little boys.
Yes, we share an office, we're neighbors, and we're besties. And
Yeah,
it's just
amazing.
We're living our best life over here.
I know, and doing a really cool job. I'm thankful every day to get to do this job.
It's so true. Every day I'm like, yes, I can't wait to go to work and actually mean it.
Yeah, every day. It's so great.
Yes. So Amy, I wanted to start today by talking about health and why United Way focuses on health.
Right. So health is one of the three pillars for United Way: health, education, and financial stability. And it's really central to lifting Alice up. We need all three of those pillars to work together. Mm-hmm. And health is really about allowing folks to be in the position to achieve their full potential.
Mm-hmm. Okay, so as you mentioned, United Way serves Alice population. That's basically the subset of our communities who are working, they're employed, they're above the federal poverty level, so they don't qualify for those programs, but they don't make enough to make ends meet.
Right.
So someone in that situation, if they are just working and sometimes more than one job and doing their best to just make the rent, pay the power bill, all those things, how does health factor in there?
Right. Well, like anybody, you can't work or do a good job helping your kids with homework if you're in bed sick. But really, it's also about financial security and income and education, because you can't learn when you're sick, just like you can't learn when you're hungry. And a lot of issues related to income, think debt, foreclosure, can be related to unanticipated medical expenses. So it's really important to focus on thinking about how do we prevent those for individuals in need. And for us, that means opening up the door to health. So creating greater opportunities to access preventative and ongoing primary care.
No, that makes a lot of sense. So if you are kind of living on that edge of stability, right, maybe the last thing that you're going to be able to do or that you have time for or, have the funding for a copayment, if you have insurance, the last thing you're going to do is go for a checkup.
Oh, right. Absolutely.
Yeah.
I mean, you might not work the kind of job that where you can take off for a couple of hours and go get your primary care checkup, a wellness visit. But I think the other thing is the people might not know is that this area, Southeastern Idaho, but really almost all of Idaho. So unless you live in Ada County or half of Bonneville County, you live in a health professional shortage area. That's for primary care, mental health, and dental health. So there just aren't enough providers in our area to meet the needs of the community, and we know that. And that's precisely why we have to focus on prevention.
Okay, and so that's for people who are able to get to the doctor even.
Absolutely.
Okay.
Yeah.
So I know that at United Way we've done a study to look at Bannock County specifically. Tell me about this. What did we learn? Why did we do it? And what did we learn from it?
Yeah, so this was a really unique opportunity. It's part of a new branch of the Idaho Department of Health and Welfare, focused on what's called upstream solutions. So here's a metaphor to really help us think about that. When we're doing work in the community, we're really focused on thinking about how do we save the people right in front of us. So we're standing at a riverbank, pulling kids out of the river.
Yeah.
But what if we walked upstream and we saw that there was a hole in the bridge? Maybe instead of continuously pulling children out of the river, we should fix the bridge.
Yeah.
And that's the vision behind the Get Healthy Idaho project. So this is a statewide initiative, and we received a competitive grant a couple of years ago, I guess 3 years ago now. We're starting our third year. And And this grant allowed us to do a community needs assessment. So we were looking at health and what are called the social determinants of health. Those are all of the things that happen outside of the four walls of the clinic that drive health impacts. And really, 80% of health impacts are driven by those things. So when we ask doctors to keep us healthy, it's we're kind of asking a lot because we're asking them to control tons of things that just are outside of their control. Housing, food security. So what we did was after receiving this grant, we completed a mixed method study. So that basically just means we did a survey and we did focus groups, 4 focus groups, over 300 people surveyed, and we focused just on Bannock County. And what we really wanted to do was try to understand what was driving the health needs, specifically as it relates to social determinants of health. Because again, we want to, and Wendy's work and Molly's work and the United Way Community Investment Grants, they are focused on pulling kids out of the river. We want to continue supporting that, and we want to also do the work and bring our partners along with us to fix the bridge. So the study is aimed at understanding what's the problem with the bridge here. So we looked at tons of issues, everything from social inclusion to housing, food security, mental health, and got a really robust picture of need, how need varies across different populations and across the geography and neighborhoods of Bannock County, and worked with a team of researchers, a team of nonprofit professionals to really think through what does the data mean. We found a lot. We're still combing through everything, but some of the core things we found was that, and this is no surprise, tons of unmet need around housing, significant food insecurity, issues around transportation, issues around accessing health. And this is super surprising. It was worse for people under 55 than for older folks. So, I think that might have to do a little bit with how we deliver services in the community. But younger folks were more likely to feel like they weren't healthy. They were more likely to experience need across all of those categories we just mentioned. And they were less likely to have a primary care provider or to go seek out health care. They were more likely to be experiencing poverty. And really, we were surveying everybody who we were looking at was within that ALICE demographic. So we were what's called oversampling that population to really try to understand what's driving the health needs there.
And I think it makes sense and it is surprising that the younger generation in Bannock County is struggling with making ends meet and accessing health, and have all these reasons why not. It makes sense because we're in Bannock County, we're entering a spot where rent is very high. We are, just like everywhere else in the country, we are experiencing high rent costs. And then if you're someone who's just getting, out of high school or out of college, it's increasingly difficult to make ends meet. In addition to that, the cost of inflation, right? Like going to the grocery store is just so painful these days. And so you add all of that up. I mean, it's no wonder.
Yeah. And when you think about the ALICE budget, and for those who don't know, when United Way studies ALICE, we look at like 10 or 11 different pieces that would make up a family budget. And for the ALICE families who have 2 kids in childcare, I mean, I think you have to be making something like $30, $35 an hour just to make ends meet. And this is true in Bannock County, this is true nationwide, but families with young children are the most likely to be experiencing poverty. So, I think that was probably part of it. Also, your early career, which means you're earning less. So I think we didn't go into causality in the study, and we tried to think through a little bit of what might be causing it, but this was strictly observational for people who are interested in that kind of thing.
Yeah, totally. And I know there's a huge amount of people that will be. So let's go back for a second to the study. So if I'm understanding it correctly, the idea behind this study was to examine what the barriers to health are, meaning that here are all the reasons why you might be struggling with your health or at least accessing healthcare. And so with the collaborative effort that you mentioned, a whole group of us got together and went over the data that came out from the study.
Yep.
And one thing that really jumped out was transportation.
Yeah.
Talk to me about that.
Yeah. So, part of this is thinking about the nature of the grant. And so the cool thing with this grant was we got the first year to do a really robust community health needs assessment. We'll have projects for the next 5 or 6 years just pulling more information out of this data. But we get 3 more years of funding. And that is super exciting because what it meant was we could take this data and then make something actionable.
Yeah.
And the reason why transportation was attractive to us was it came up consistently as an unmet need. It came up in both the survey and the focus group. And I believe it was around 20% of respondents identified transportation as a consistent unmet need.
Yeah.
But the other thing is, given the size of the grant, we could get our hands around it. So the grant is about $100,000 a year for 4 years. I mean, that wouldn't even be enough to build one new house right now.
Yeah.
So similarly, if we think of food, we have amazing partners in the food bank. And we need to let the experts there be the experts.
Yep.
Kia and all of those folks are just doing a fabulous job. We coordinate with them. But one of the things that we saw the community struggling with was getting to the services. So we have so many amazing partners. Some of them, you can walk from one place to the other. You can walk from Aid for Friends to Valley Mission.
So you're talking about if someone wants to go to a doctor's appointment.
Yes.
That's what we mean. Okay.
A doctor's appointment or get a food box. I mean,
Yeah.
really access any of those social determinants. We noticed that there was just barriers. So think about how Pocatello's laid out. There's a train tracks that go right through the middle of town.
Yep.
If you live on the Old Town side, but maybe you want to go to ISU to go, further your education, how are you going to get there? If you don't have a family car, or if that car goes with the family member who's working full-time, what do?
Yeah.
Or if you live in Chubbuck, but you need to go down to St. Vincent de Paul to get a food box, how do you get there?
Yeah.
And those were the challenges that we thought not only were consistently arising, but nobody was doing it, so we didn't want to duplicate services. And given the amount of money we had, we knew we could get our arms around it.
Yeah. Okay, so 1 in 5 of us in Bannock County have a major issue with transportation. And so that's the problem, right? So what is the solution?
Yeah, so for us, that's Ride United. And we were so lucky to be able to launch this program. And for us, Ride United is a 3-part program. So the first part, and the part that we talk the most about and that we share a lot on social, is our partnership with Shuttle. So that is a point-to-point transportation solution. So United Way covers the cost, and social workers or case managers from partner agencies, right now there are 5, the Free Clinic, the Southeast Idaho Behavioral Health Crisis Center, D6 Treatment, Health West Mental Health, and the Center for Hope South. And they're all based out of the Portneuf City Center campus, which is right by City Hall.
Yeah.
So it's an integrated mental health services hub. Mental health came up a lot on the survey too. So we were really intentional about this choice. A lot of those agencies serve low-income community members, but again, struggle with this piece of getting folks in the door. So we really wanted to take that barrier away and make it low barrier for partner agencies. And so from a community member's perspective, they just get a ride. They get a ride on time with dignity. There are all kinds of boring policy pieces that we cover, but basically, if you don't have another option, Ride United has you covered, and that's the vision. We also did a partnership with CCOG, Southeast Idaho Council for Governments, and provided training for community members and case managers and social workers to learn how to use the public transit system. So we really wanted to double down and invest on the accessible transportation options because that's not going away. It's super important.
Definitely.
And the last piece is delivery. So we have a program in partnership with United Way Worldwide called Ride United Last Mile Delivery. And with Gate City Christian Church and St. Vincent de Paul, we deliver food boxes for free using DoorDash to community members. So,
Yeah.
Think about those days when it's 100 degrees or there's knee-deep snow. There are community members waiting in line, walking and carrying a heavy food box back and forth. But, that's not only is that physically grueling, it's very time consuming. So, for community members who, maybe need to be home with littles, have health conditions, we're making sure that they get food, resources in a timely manner, easy, simple, free for them, free for our community partners. And it's been super popular.
That makes so much sense. There are a huge amount of people who would benefit from that. What does that mean for someone who is able to get food delivered? What does that mean?
Yeah, it means more time with your kids. It means a full belly. It means not worsening health conditions that you might already have. There are many, like diabetes, for example, huge health need across Idaho.
Yeah.
And if you're not able to eat regular balanced meals, it's going to get worse. And this is one of those easy preventative resources that we can provide to community members.
I love that solution. Let's go back for a second to the Ride United piece. So if you are a member of the community and who has a need, maybe you've made it to one of the appointments at the Pocatello Free Clinic,
Right.
And you get to the point where you're setting your next appointment. So often it sounded like that people would get to that point and be like, well, I don't know how to get there.
Exactly.
And so what have you heard from our partners like the Free Clinic with this experience? So walk us through what that has meant for them, what that looks like.
Yeah, and I think it's really two-sided. One is from the partner perspective, so from the staff who work at the nonprofit partners we support. For them, it's been a game changer because they can just solve a problem and we're just able to put the tools in the toolboxes that they need. You said a little while ago, we want to let the experts be experts, and we know that the staff at the Free Clinic, for example, they're amazing. They know how to help people.
Yes.
And we just need to give them the tools to provide that care, and they're going to do great. So for them, it's just been easier. They have very minimal reporting. They just have to coordinate with me. And then for community members, the goal is really serving them with dignity and ease. So from their perspective, they just know they have to work with the front desk and book the rides back and forth. So for them, it's like really easy. They don't have to even worry at all about the infrastructure that's supporting it. It's just a benefit that they can have access to.
Yeah.
And for me, that's what means so much, is that we're not asking them to say, to come up with a bunch of reasons or to tell a difficult story over and over again just to get like prenatal care. And that's, for them, what it means is my baby's taken care of. My chronic condition is being managed. I'm able to go get cancer treatment. I'm able to go get my mental health intake work done. So it, for them, means they're just having a problem solved, and it's finally an end to that constant cycle of searching for solutions, and I think that's what's so huge.
Definitely. No, that's honestly such an incredible solution. And have you seen or heard from our partners on attendance, and meaning that when you offer Ride United, are people more likely to go to the appointment?
Absolutely, yeah. So the Center for Hope and Recovery, Benji in particular, we love you, Benji. He is so good at providing me follow-up. They've had no call, no shows. So
Since Ride
United. And they use it about once a day.
Yeah.
So that means people are staying in recovery, which means families are staying together, which means those individuals are now, getting GEDs, going back to school, getting long-term jobs, becoming stable. That to me is like not just obtaining recovery, which is amazing, but maintaining recovery and the amazing work that the Center for Hope South is doing. It's life-changing, and just to be a small player in that is huge.
It's amazing. So, Ride United, how many, rides have we given, or how many miles worth of rides? What does that look like? Where are we at now?
I mean, hundreds of rides every month. So we think of a ride as one way.
Okay.
So I think last month it was about 250, but we're over 6,000 miles. I try to do monthly posts, giving a metaphor. So was it June? I think we had hit longer than the Great Wall of China.
Nice.
And for those who don't know, it's not a continuous wall. It's like lots of little walls. So, but if you were to stitch all of those little walls together, that's over 5,500 miles. But we're well over that now. I mean, now we're over 6,000, so I need to come up with a better metaphor.
So that's basically farther than the distance from one end of the country to the other.
Yeah, that's back and forth. So you could drive from California over to, Maryland or New York, pick your East Coast city.
Yeah.
And back. I mean, that's how many rides. And each one of those rides is somebody getting a core need met that is related to observed deficits are going back to the city. So going back to the study. So it means people getting to the free clinic. It means folks who are getting their mental health needs met, folks who are maintaining recovery. And it's just, it's amazing to watch. And we even have had some community members have potentially fatal conditions detected and then treated because of this program. And if you think of the cost of it, it's like some of these rides, it's like $15.
Yeah.
$15 to prevent an ambulance ride, $15 to prevent a $3,000 emergency room visit, $15 to save a life. And to me, it's a no-brainer. Like, we can sustain this, we will sustain it, and it's making a huge impact for our partners and the community members. And that's, Alice is who it's all about and who we want to serve.
I love that. Maybe let's talk about one of these specific stories.
Okay.
Because that sounds so incredible, but maybe bring it to a personal level.
Right.
Tell us a story about that.
Yeah, I mean, there's so many stories that I'm fortunate to get to hear from our partners, but one that I love mentioning because it really brings it all full circle. There was an elderly couple. They lost their home during the pandemic. They're on a fixed income, so as housing and rent, those costs rose. They were forced into homelessness and were living in a hotel. The wife has been disabled for a long time, and so like most people who care for somebody with a disability, your needs come second, their needs come first.
Yeah.
And that's what this husband was doing for his wife day in and day out, in addition to trying to find stable and secure housing. He decided to establish primary care at the free clinic during this time. And at that visit, Ride United first took him to that visit. The physician identified a critical heart condition, and they were able to get him right to Portneuf into emergency surgery. And not only that, so the surgery was life-saving. He's doing great now, but his wife was able to come visit him. So to me, this is so great because it shows the importance of course, primary care, getting in to see your doctor for those regular checkups, because he had no idea, that there was something so wrong.
Yeah.
But also social inclusion, having your partner be there for you when you're waking up from surgery.
Everybody deserves this.
Yeah, housing, understanding the effect that not having housing can have on a person's health.
Yeah.
If you're so focused on a day-to-day crisis situation, you're not getting your health taken care of. And I think that was very much the situation for this family. The burden that individuals with disabilities face, and it all came to a head at this moment, but we were able to just make sure they got the help they need, they were served both in terms of their health, but also in terms of their mental health, supporting each other through that, what I imagine was such a difficult couple of weeks for them. But at the end of the day, they're both here, they're both healthier, and they've been really great partners for us in terms of being willing to share their stories with us in a more public way. So it's just, we're just so fortunate to have community members who have such courage. And I think that was also the truth going through the study. Every single respondent showed enormous courage coming forward and talking openly and with a great degree of vulnerability about the challenges they faced. And I know you know that because you helped with the study at various points, which was amazing.
Yeah, that's such an inspiring story. And, you know, I just can't help but think every single person deserves access to health. And is there anything that you would wish for the Ride United program? Is there anything, if you could wave a magic wand, like what do you hope for the program?
My number one goal right now is sustainability. So we have 2 more years of funding, and I'm working on developing a strategy to create a new revenue stream that will specifically benefit this program. What I hope that looks like is partnering with more healthcare agencies and working with them both to understand the health needs that they're addressing and to design solutions that are proactive. You know, again, like I said at the outset, we have a lot of need, but a limited number of providers to meet that need. So when you think of it, this is the model I always use, like classic economic supply and demand. We have a huge demand for providers with a limited amount of supply. So you and I can't fix a supply problem. There are lots of amazing people working on that. But in the meantime, we've got to bring down demand. And so we've got great partners across the community doing that work, like the Portland Health Trust, who has funded this United Way quite a bit. They're doing amazing work with their Healthy City USA program. But we are, you know, right there with them, shoulder to shoulder, thinking about how do we decrease demand. Ride United is a big part of that. And I think continuing to build these kinds of partnerships is just going to be absolutely key to sustaining it. So, I mean, really, this kind of thing that we're doing right now is perfect because getting the word out about it, building relationships, building trust, and continuing to find individuals and find organizations that believe in this kind of preventative work and finding a way to make it work for all of us. So I know we can make their business model more effective for them, and we can sustain these programs by partnering. And so that's what I'm hoping to do more of.
Okay, that sounds great. So if someone is interested in learning more about how to get involved, how to learn more about that, what should they email you? What does that look like?
So the best way is just to email me, AMY, Amy, at unitedwaysci.org. And this can be for anything from learning more, talking about sustainability initiatives, some of what we're doing there, but also folks who might just be interested in the study. I get emails, this is kind of surprising, I get emails about once a week for folks who are interested in the study. So I just connected with a student a few days ago from ISU who wanted to read it, and it's a 66-page study, guys. So,
it's intense.
It's not necessarily the most exciting thing to read, but if you care about understanding how to help the community, then it's really engaging. And I think that's who we are in Bannock County and Southeast Idaho, is a community who cares about each other. And
that's right.
Yeah, and so that to me just demonstrates it, that, you know, folks are taking the time to read this and then to partner with us, partner with each other to make Southeast Idaho a healthier, better place for everybody.
Absolutely.
Yeah.
Amy, it's been such a pleasure to talk about the barriers to health and talk about United Way and your work to provide solutions to that in Bannock County. Thank you so much for joining us today.
Oh my gosh, I'm so happy to be here. Thank you for inviting me.
Yes, it's awesome to be here with you. And this has been Igniting Change United Way, Unfiltered. And we will include your information in the show notes. And we just want to say thanks for joining us.